name is Giulia Dagliana. I'm from Italy. I work for the Center for Clinical Risk Management and Patient Safety in the Tuscany region. We are based in Florence. My center is also a World Health Organization collaborating center in human factor and communication for the delivery of safety and quality care. And we are also a center of excellency of the Istituto Superiore di Sanità at the national level. The activity that we do at the regional level is to coordinate all the activities related to safety, quality of care in our hospitals, in the hospital of our region. Us, it's really interesting the idea of developing resilience inside healthcare systems, and of course we work at a micro level while you are talking about crises that happen at the macro level. But I think that most of the concepts that have been developed during these 3 days can be used also for dealing with crises that happen at the hospital level, like when we have to face a serious adverse event that happened to a patient, and there we have to face with a crisis that involve healthcare operators, that involve families, that involve parents of if we are talking about the children. Most of the concepts that Darwin developed, like the one on communication, the one that talk about understanding what went well instead of focusing just on what went wrong, and also focusing on the work as done rather than the work as imagined, can be something very important also for our organization, talking at microsystem level. I think that we can provide some experience on how to communicate with media and with civil society after a crisis develop, because we have a lot of experience in communicating adverse events that happen in the hospitals to media, to television, to journalists, and also to family. And I think that this can be a contribution that we can give. We have also experiences in writing guidelines and best practices for patient safety and risk management. So maybe this can be another kind of contribution that we can give. And also we have experiences in applying method for risk assessment and risk management. Generally we use the audit method for analyzing adverse events, and can be also useful for analyzing the development of a crisis, or also the failure model and effect analysis. That is another method for finding the critical area in a process and try to give priorities for developing mitigation projects on the specific for dealing with the crisis in a specific phase. So I think that these 3 main topics can be our contribution to the DARWIN. Of course, my interest is in healthcare. The interest of my center is in healthcare. So I really hope that the healthcare system can provide more experts for and participating in this project.